Hi there, my name is Nick, and I'll be covering the anxiety disorder of obsessive compulsive disorder. So, what is an anxiety disorder? An anxiety disorder is something that everyone can relate to. Everyone knows someone with an anxiety disorder. It is important to our health. It can be make us focus on certain things, make us fear losing our jobs, so we work harder. But some anxiety disorders can be bad, and they can have excessive fear and persistent anxiety, and they have disturbances in our behavior. It is, like I said, it's a universally experienced thing. There's 25 to 30% of the U.S. population has at least one anxiety disorder during their lifetime, and during a 12-month period, 23% of women and 14% of men will experience at least one anxiety disorder in that year. So anxiety disorders also cause very, very high amounts of distress. And this is the most commonly occurring mental disorder of all disorders. Next, we'll start noticing the comorbidities of anxiety disorders, and a general anxiety disorder is the most comorbid of anxiety disorders. So our comorbidities are like symptoms and complexities that are similar with other disorders within anxiety disorders. So like I said, the general anxiety disorder has three big disorders that are like symptoms shared within a general anxiety disorder. One of them, depressive disorder or depression. Another is bipolar disorder or BD. And the last is substance use disorder. And these all share similar symptoms to general anxiety disorder. So the disorders with such similar symptoms or comorbidity make it harder for psychologists to treat their patients, and that can be very difficult to single out one disorder to focus on for psychologists. So this is a very difficult job for them to do. So we were asked to find a media portrayal of an anxiety disorder and give an example, and I found the movie Matchstick Men starring Nicolas Cage to be a shining example of a media portrayal of an anxiety disorder of obsessive compulsive disorder. Now, my thoughts on its accuracy is that it might be a little dramatized at times. Nicolas Cage is spending like a whole scene or a whole day scrubbing his entire apartment down because he found one dust bunny lying on one of his pieces of furniture. With that being said, I don't think it is out of bounds. I think it does a great job showing the world and the public the effects that OCD can have on an individual and how they fight those internal battles every day and the struggle they go through just to live a normal life. Moving on to what is obsessive compulsive disorder. So this is a type of anxiety disorder, and the individuals that experience OCD are people that struggle with these urges that are unwanted, they're intrusive, and these constant thoughts that they feel that they need to carry out an internal or external repetition of behaviors and mental compulsions in order to suppress these feelings. And these repetitions can be, like I said, thoughts. Let's say you have a neighbor that said something bad about you and you run it through your head constantly. That could be a repetitive OCD type thought, or an action like Nicolas Cage in the movie, closing the door and shutting it 3 times every time he walks in and out of a room because he needs to suppress that obsession trigger. So these repetitions are used to suppress the fear or distress that obsessions trigger. And like I said, these repetitions aren't performed because these people. Moving on to the underlying theory for the cause of OCD. There are three main theories that I was able to research about. One of them was biological, another was cognitive behavioral, and the third was psychodynamic. Now, throughout studying all three of these, I came up to the fact that the psychodynamic had to be the best theory. And because the obsessions and compulsions are signs of this unconscious conflict that you might be trying to suppress. A person is dealing with inner struggles that they need to deal with, but the only way they can deal with or cope with it is an unconscious, or they're at odds with their socially acceptable behavior. When conflicts are extremely repulsive or distressing, you can deal with them only indirectly by transferring that conflict to something more manageable, like a hand washing, checking, and ordering things. Just you deal with this because you're suppressing these thoughts, and that is why the psychodynamic theory makes the most sense to me. If we're talking about the history of OCD, it was once known and relatively common disorder, can be traced historically across a broad spectrum, and it used to be called scrupulosity, and it was more so a religious thing than anything. It was supposed that a problem came from a religious context, and people were obsessively concerned with sinning, and a compulsive performance was driven from that sin of a severe compulsive devotion to religion. And that kind of behavior was studied, and it encompassed all types of obsessions and compulsions. They used that as a kind of a launch piece, and it wasn't until a theorist by the name of Carl Westphal actually described OCD and defined it as OCD, obsessive compulsive disorder, in 1877, and it was then in classification manuals. It included integrity of intelligence, absence of effective causal pathology, the inability to suppress the intrusive thoughts, and recognition of the bizarreness of the representations. Freud went on to put his own little spin on it with neurasthenia, and later on it was evolved that major people in our history, such as Martin Luther King, Howard Hughes, or Katharine Hepburn, or Charles Darwin even, have suffered from OCD. So it has evolved through the years. It used to be religious melancholy, then it was down to scrupulous and monomania, and then lastly OCD. So for the symptoms of obsessive compulsive disorder, OCD, people are always constantly doubting themselves. They're double checking things over and over again. They're making sure everything is perfect and in place. People have anxiety about getting sick. They might find themselves cleaning too much when things don't need to be cleaned, or they're washing their hands so much that they're getting dry hands and cracking. They might be overcounting things. They might be worried that they don't have the amount of money that they might have known that they had, so they keep counting. They'll keep organizing things when they don't need to be organized, just overcompensating, and then they start accumulating items, and they might not want to get rid of them, and they're constantly checking in on their loved ones. Are you okay? Are you okay? It might even be every day, and you know how relatives can get if you check in on them every day. And they have constant fears. It's just a constant fear or anxiety of something, an internal battle that they can't deal with. So they are displaying all these symptoms in order to deal with that. For the effective treatments of OCD, it has been said that cognitive behavioral therapy and medication are the cornerstones for dealing with it. But when we're talking about cognitive behavioral therapy, the most effective treatment out of CBT is exposure and response prevention, which is called ERP. And it's typically done with a licensed medical physician, mental health physician, psychologist, a social worker, or mental health counselor, and in outpatient settings. And you'll visit a therapist's office at a set appointment a couple times a week, and you'll start with that. And after that, medications are prescribed by a medical professional on a treatment plan as well. And so if you're taking your ERP and your medication together, that's like your first line kind of defense treatments. 70% of people will benefit from this combination to combat their OCD. When we're talking about ethical concerns for the treatment of anxiety disorders, and this could fall under obsessive compulsive disorder, the ethical concerns that are raised regarding the exposure treatment are the system exasperation. So like you're trying too hard to cope with these symptoms, people are pushing you too hard, and you're making it worse. Something's not right with the treatment, and you're making these worse by overemphasizing everything. So that's one ethical concern. There's also a high treatment dropout rate, which can lead to, what are these professionals not doing in order to help these people, and they're not looking at themselves in the mirror and saying, what can we do better? Client safety concerns, that falls underneath the same realm of the high treatment dropout rates. And lastly, the blurring of boundary lines between a therapist and their clients. A professional relationship needs to be maintained, and it cannot be crossed, because once that professional relationship is torched, then it becomes hard for the patient to know what the difference is between treatment and the friendship. So those are the ethical concerns surrounding anxiety disorders and OCD. So lastly, we're talking about obsessive compulsive disorder and the effect on an individual's environment. So these obsessive compulsive disorder people, obviously they're going to be demonstrating their symptoms and signs in public. Maybe most of them are driven to be home more often or not go out into public because they don't want to be judged. So that's a major key right there. Maybe these people suffer from social anxiety because of their OCD, and that is another cross symptom disorder that we could highlight right there. So maybe it's a social thing that is affected because of the OCD. Your quality of life is going way down if you're spending too much time on these simple, minute things, and you're stressing way too much about these internal conflicts. What are you going to be able to get done? Your daily functions are going to be limited to what you can do by yourself. There has to be someone with you to make sure you're in line and keeping on the right track in a timely manner, or you're going to be stuck doing your OCD compulsive movements or thoughts all day. So this can probably drag you down with your ability to progress either in education or career-wise, because of your constantly needing to deal with these internal struggles and battles that you're faced with every day by exhibiting OCD behaviors.